Good morning, everybody. I'll be presenting my study on safety and efficacy of alcaftadine 0.25% and olopatadine 0.1% in patients of allergic conjunctivitis. So allergic conjunctivitis, it is a IgE-mediated allergic condition which includes symptoms like redness, tearing of eyes, swelling, and a significant impact on quality of life of patients. So generally, there are a lot of drugs for management of allergic conjunctivitis, but nowadays first-line drugs are dual-action agents, which are antihistaminic and mass stabilizing drugs. So olopatadine is a very well-established drug, whereas alcaftadine is a recently approved drug, 2016. So it has a action on multiple histaminic receptors, H1, H2, and H4. So the rationale behind our study was that alcaftadine has a broader antihistaminic activity, and it has also has anti-inflammatory properties, and many studies have shown that it has faster onset of action. So aims and objectives of this study were that to compare the efficacy and safety of alcaftadine versus olopatadine in patients of allergic conjunctivitis, and to measure change in parameters like TOS, total ocular symptom score, and CHS, conjunctival hyperemia score, and to measure change in quality of life of patients with questionnaires like EPIC, and also to measure the adverse effect and safety profile of the drugs. So this was a prospective, randomized, open-label and comparative society study conducted in the Department of Ophthalmology and Pharmacology. Total 110 patients were recruited, divided into two groups, and one group was administered alcaftadine 1 drop daily, and another group was administered 0.1 olopatadine 1 drop twice daily. Follow-up was done on day 15, day 7, 15, and 30. So all patients aged 10 to 60 years of both genders with clinical diagnosis of allergic conjunctivitis, they were recruited in the study, whereas patients with recent ocular infections, recent intake of antihistaminic topical drugs, pregnant or lactating patients, or with increased intraocular pressure, they were excluded from the study. So efficacy was measured with TOS and CHS. Quality of life was measured with a questionnaire called EPIC. Safety was evaluated with adverse effect checklist. Now coming to the demographics, total of 110 patients were recruited. Mean age was 38.8 years. Now coming to TOS. So both drugs, they showed significant reduction in TOS over the follow-up period, but alcaftadine, it showed greater symptom reduction. Coming to CHS, conjunctival hyperemia, both drugs showed significant reduction over the follow-up period, but alcaftadine, it showed significantly greater reduction in the CHS. Now coming to quality of life, eye allergic patient questionnaire. So it included 4 domains: symptom index, daily life index, psychosocial index, and treatment satisfaction index. So both drugs, they showed improvement, but alcaftadine, it showed greater improvement day 15 onwards. So this is the daily life impact index, psychosocial impact, and treatment satisfaction. Now coming to safety evaluation. So both drugs, they showed adverse effects, but olopatadine, it showed more adverse effects. The adverse effects of olopatadine, they were more systemic in nature, like altered taste and headache, but whereas the alcaftadine ADRs, they were mostly local, stinging sensation or burning sensation. Now comparison with causality assessment scales like WHO Uppsala Monitoring Center scales, so they showed that alcaftadine had significantly less severe causality. So now key takeaways from this study. So both agents, they were effective and safe, but alcaftadine, it produced faster and significant symptom reduction, and alcaftadine was also associated with better quality of life outcomes. So strengths and limitations of the study. Ours was the first study to evaluate the safety of the drugs associated with allergic conjunctivitis. Ours was the first study to evaluate the quality of life in patients with allergic conjunctivitis taking alcaftadine and olopatadine. And limitations were that we had a modest sample size. It was a single center study, and just 30 days of follow-up. So in conclusion, alcaftadine, it demonstrated superior symptom control, greater hyperemia reduction, treatment satisfaction, and better quality of life. And it had a favorable safety profile compared to, these are my references. Thank you.
Dr. Pankaj, you already said that alcaftadine is a well-established drug. So what was the need for doing this study, number one? And do you think 30 days trial or 30 days, clinical trial comparing the symptoms and all that would definitely make a statistical significant study?
So there had been studies which showed that alcaftadine was superior to olopatadine, but there were also studies which showed that it was equally effective as olopatadine, and there hadn't been any quality of life studies. So ours was the first quality of life study.
But I think 30-day study is not going to make the much difference. And another thing is, what is the TOS scoring? How do you score the things on TOS?
So TOS is scored as, there are different scores given for tearing, swelling of eyelids, and redness.
How do you grade them? What is the grading?
So 4, 3, 2, 1. Sir,
Which one is severe?
so 4.
You have a patient of allergic conjunctivitis, about a young boy. How are you going to start the treatment? What all drugs will you use besides this thing? Antihistamines, what other drugs will you use?
Sir, other drugs that can be used can be, sir, corticosteroids, sir, or sir, NSAIDs.
NSAIDs.
Sir.
Okay. So what corticosteroids will you use? And for how long?
Sir, in tapering doses we can use, sir, for a few
Okay.
days.
Okay. What corticosteroids?
So
Okay.
FML, sir.